Okay, I'm back. So, my phone ended up dying when I tried to pause the video, so I apologize. Um, so where I left off on the last video was I got to the point where I wanted to have my independence back. So I was starting to push things, um, perhaps more than I should have. I am a terrible patient. I really am. Um, so by that second week, I decided, okay, I'm feeling good enough to go up the stairs. You know, if I can walk to the end of the block and back, I can go up the stairs. I went up the stairs. I got into my own room, changed my clothes, took a shower by myself, which felt great. Laid down in my bed, and within about an hour, I was in pain. I overdid it. So I had my husband bring me food in the room. I didn't go down for a couple days, just so that I could stay upstairs and close to the shower. But because I needed to continue walking, I ultimately went downstairs after about 2 days. My husband asked me not to go back upstairs for a while. So I waited another probably 4 days before I went up again. Excuse me. So after about 4 days, I started getting to the point where I would go up the stairs just once a day. So it was only at night. I would go upstairs to go to bed and I would rest it off. And then the next day, I would just come downstairs and I would spend the rest of the day downstairs. At that time, I was planning my wedding. I got married on September 7th, which was 6 weeks after my surgery. So between healing, getting ready for the next school semester, um, and planning my wedding, I had a lot to do even though I was off work for 6 weeks. Um, I started school 3 weeks after my surgery. My dad drove me to school most of the time, um, at least for the first week there. I ended up kind of doing too much emotionally after my surgery. So I feel like that really impacted how well I did during the semester. So ultimately, I have to retake 2 classes because I was going to get C's, and you can't retake the classes when you get C's. And you also don't get into the nursing program when you have C's. So I failed on purpose. It was a plan between my counselor and my instructor and I. Um, so I'm going to retake those classes later on. It did kind of give me a setback, which I took really hard at first because I had a plan, and I think that all all things aside, I had a plan before I got diagnosed with cancer. I was going to go to school and I was going to be a nurse and everything was going to be fine. My husband and I were going to keep on trying to have a kid. Cancer was never part of the plan. But I'll touch more on kind of the emotional aspects later. I want to keep this more about post op. So I was driving at 3 weeks. I have not, to the date, been able to really do a lot of exercise. Um, I was experiencing a lot of intermittent kind of bloating here and there. Now, for the bloating, it's pretty normal for me because I have polycystic ovarian syndrome. So I have those symptoms of bloating and swelling and pain in my pelvic region since forever and a day ago. Um, so I noticed that immediately post op, I didn't feel much of that. I felt a lot better than when I had the cancer. The cancer, I don't care what anybody says. My oncologist told me that this cancer doesn't cause pain. He said that the pain that I was having prior to the surgery was not cancer related, it was probably something else. I felt 10,000 times better immediately after the surgery. I'm starting to notice now that a lot of that bloating has to do with sugar intake, carbohydrate intake. So I'm finding that that's probably more related to insulin resistance that's related with PCOS. So when I talk about my symptoms, do know that I also have another underlying condition that could possibly be contributing to the way that I'm feeling. with the surgery. So, I immediately after the surgery, I felt 1,000 times better. Like I said, I wasn't eating as much. I wasn't eating the same things. It was a lot of high fiber. It was a lot of fruit. It was a lot of much smaller, very small portions. So it is a potential possibility that it was the way that I'm eating or was eating that did help me feel a lot better too. So take that all with a grain of salt. At my 6-week post-op appointment, my gynecologist oncologist, who was, the mean doctor, if you remember, I have a nice and a mean gynecologist oncologist. The one who I refused to allow to do the surgery because I didn't trust him to leave my ovaries. He was the one who I met with who had to read me the pathology report. The pathology came back with the following notes. I had my fallopian tubes removed, the uterus was removed, the cervix was removed, and they removed 4 lymph nodes, 3 within one side in the fat tissue, and then another one deeper on the left side. He just kind of picked at random to see. So everything came back negative. There was no invasion of the cancer into the uterine muscle. There was no cancer present in any lymph nodes, in any of the fallopian tubes. When they opened the uterus, actually the oncologist, when he did the hysterectomy, kind of cut it open just to see what he could see from, with the naked eye. He was able to see the polyps. They ran the pathology on everything, and it was determined that the cancer itself wasn't even prevalent in the lining, so much so as just in the glands that produce the lining. So per my oncologist, this meant that my cancer was downgraded to a glandular cancer, which meant that I required no further treatment, no chemo, no radiation, nothing. And that maybe it was a good idea after all that I decided to keep my ovaries, which I'm thankful for because I intend to try to conceive via gestational surrogate, hopefully this year. So I wasn't experiencing the bloating. The pain for the most part went away. For, I want to say, the first 3 months, I felt really good physically. Emotionally, I felt better than I thought I was going to. I thought that I was going to feel like part of me was missing. I thought that I was going to feel like I was less of a woman. I thought that I would lose sexual arousal. I didn't lose any of that. I am very much still myself. I'm very much still my spunky, outrageous, happy person without, the pain and without the bleeding, which was often and bad. I thought my sex drive was going to die. It did not. In fact, waiting that 6-week period was actually really difficult. For whatever reason, my hormones, instead of doing what I thought they do, they did the opposite. And I was just like, okay, I'm ready to go. Let's do this. And it was amazing the first time because I hadn't realized how much the pain had impacted our interpersonal relationship. I hadn't realized that I hadn't enjoyed it like that with no pain in a really long time. There was also a fear that I would have no natural lubrication anymore. That is, at the time, no change. Like, everything was great. It was perfect. Things have been changing progressively since. Now, keep in mind, it takes 6 to 8 months for your body to kind of really recover from these surgeries. So I'll kind of do a follow-up video to how things have changed over the past few months. But for that first time, everything was good, which is great because we got to be newlyweds and we got to be close, you know, when we needed to, even though it wasn't the day of the wedding, but it was just a few days later. I mean, it was so much just jam packed into 6 weeks between the surgery and healing and the wedding and going back to school and going back to work. It was an awful lot, and I do things like that intentionally because if I keep busy, then I'm not sitting there, you know, overthinking things, which is something that I just tend to do. So, that's how I felt pretty much for the first few weeks. You know, I felt pretty good after the pain went away, after I was able to go up the stairs, after I was able to walk and not have leg cramps. For the most part, I felt good. I did still have to deal with some constipation intermittently. I didn't try the calcium nitrate again. Yeah, don't do that. Um, but I want to leave off with it wasn't as bad as I thought it would be. It's hard at the time. It's hard to be patient. It's hard to be a good patient, for me anyway. It wasn't as painful as I thought it would be. It wasn't as long as I thought it would be. I mean, yeah, the time period was what I thought it would be, but I thought that it would feel like forever to get up and to move around and to be independent again. And virtually the time just flew by. Essentially because I kept myself as busy as I did. Don't be afraid of it. When it gets to the point where the surgery is needed, have a good support system. Have your azo, have your docusate, have your gas X at the ready. Have help. Have a shower plan. Have a pillow for the ride home from the hospital. And just take it a moment at a time, a symptom at a time, a day at a time. And it just passes. Everything does pass. So I will be doing another video about the emotional state at the time, and following up, and how I've been dealing with the whole concept of infertility. And then I'll do another one about the following months after the first few weeks of recovery. And I will do another one about my 6-month follow-up with my gynecologist oncologist, which is coming up on Monday. Thank you. Bye.